We're discussing a matter of profound cultural importance that has become a national tragedy: the safety of initiation schools in the Eastern Cape. The summer initiation season is now underway, but it begins under a dark shadow. Last year, 34 initiates died, and the recent winter season saw 11 more deaths. In total, since 2016, over 370 young men have lost their lives, and more than 110 have suffered penile amputations. In the province, in an extraordinary move, the president of the Congress of Traditional Leaders of South Africa, Mokwena, has called for a 2-year moratorium on all initiation schools in the Eastern Cape, stating that the situation is embarrassing and that illegal schools remain a huge challenge. I'm now joined by Eastern Cape CoGTA MEC Zolile Williams. Mr. Williams, appreciate your time. Thank you so much for joining us. Now, MEC Mokwena has called for a 2-year pause, calling the situation embarrassing. Is this drastic measure the only way to stop the deaths and dismantle the criminal networks operating these illegal schools?
Good morning, Hugo, and good morning to the viewers at home, and all of you have a blessed Sunday. Well, Hugo, we have since through the House of Traditional Leaders interacted with the president of CoGTA, and he indicated to us that he was quoted out of context because he believes that with the efforts that we are undertaking, we can make some improvements. I mean, I agree with you, Hugo, that the death of initiates is unprecedented and should be avoided at all costs. So what we are currently trying to do is we are training traditional surgeons and traditional surgeon assistants. We've had trainings in Krisani district, Alfred Nzo district, OR Tambo. We were in Buffalo City and Amatole district these past 2 months. And we're using trained medical doctors and our district management officers from the Department of Health. Our focus is to empower them to practice traditional circumcision in a clean environment, in conditions where they understand what it is that must be done. We're not only focusing on those that must just exercise the circumcision, but also the nurses that must look or take aftercare forward. And those actions were appreciated because we're trying to also address those that are exercising the tradition illegally. And so there was really excitement from them to get this training. And this we're trying to prepare for this summer season. We are intending and intentional and deliberate to try and ensure that at least we go for 0 deaths this summer season, which is why we have held also imbizos of all those who are already circumcised. Because we've found, Hugo, that most misleading information and distortions where prospective initiates are informed not to take their medication if they are diabetic or they've got epilepsy or high blood pressure. We've found that those who have already undergone the tradition are the culprits that actually creates problems for the tradition. So we are talking to them, and we seem to be getting understanding in the 5 districts that we've attended. We seem to be sharing the same sentiments that it is only through us as circumcised men talking together and trying to manage this wrong information. And what is critical, Hugo, as I step off, is the issue of parents' role in traditional circumcision, where parents must ensure that kids are screened by doctors and clinics and get authentic medical screening records, but those records will be useless if parents do not respect what they say. If the medical screening says your child is not ready to go to traditional circumcision, don't force the child, or also engage the child to try and ensure that the child doesn't go to traditional circumcision, because most of the time the doctors would have known that the child's condition is not going to make him to be able to withstand traditional circumcision. So we must honor those medical reports because they will help us. But we want kids, as they go there, they must have their medication. If they are HIV positive, bring your medication, bring your diabetes, bring your epileptic tablets, because traditional circumcision is not a cure for your chronic condition.
Let me see, you've obviously gone to great lengths in order to certainly allay the fears of those that are intending to go to initiation school in the next few weeks. But I want to touch on a number of issues, and one of those issues is the imbizos that you held recently. What was the feedback that you were getting, both from the parents of young men that are due to go for initiation, and certainly those that may have lost their kids in the process, because our number over the last few years is as high as 370. And what I didn't hear you touch on is what it is that you're doing to curb the illegal initiation schools, because those remain. We have not reported, certainly not in the last few months, of any arrests or those individuals that are operating those schools being brought before the courts of law of this country.
No, Hugo, we have arrested a lot, and we've only last week also arrested a parent who has forced the child to go to traditional circumcision to an illegal school. That child was also affected through these penile amputations. So what we did was to ensure that the parent gets arrested, and we've just captured that case as one of those that has been successful. Our police are very active in the space of managing those that are illegal. Now, what we're doing, our strategy was that by going down and train these surgeons and initiates, we wanted everyone who's exercising the tradition must come to the training program. Now, what we are having is that we take pictures of them. We have their cell phone numbers. We've got their everything, their IDs to authenticate the person who has been trained. So in Mthatha, for instance, Hugo, one of the traditional surgeons who has been practicing illegal circumcision attended because of how attractive the training was. But once he was there, we did provide the training because we don't want him to go back and steal and do it wrongly and nefariously. What we did then was that all the cases, 14 cases where he circumcised kids illegally, the police took him. After training, we took him and arrested him from there. So the might of the law is strongly exercised to ensure that we manage, but we're not only saying we must increase the arrests, but we're also saying, let's bring them on, train them, make them understand that they are dealing with a sensitive matter that has got contributions to death of, healthy kids that we took from parents, healthy. So I'm saying, Hugo, those areas, we looked into them, which is why once we train them, once they finish a week's training, the last day, we then have an imbizo of all men of that community. We transport them to one center, and their inputs were quite good because they've got lots of distortion and the role of government. In the Eastern Cape, especially in the area of Emampondweni, they would take traditional circumcision schools very far away because they thought government is against, them exercising their tradition. They want to hide away with consequences of death. So what we did was to say, no, we are with you. We are intervening because you're exercising the tradition wrongly. So we are with you. Here is what you should do. The Department of Health is going to also be providing to them all the equipment which they have been trained on. So we are hopeful that there may be a reduction, but we can only pray to Almighty God to assist us for our kids to go there healthy and come back healthy. And we also, in our advocacy, we want to deal with this issue of traditional schools, traditional circumcision schools that are misleading kids, making them monsters against women. When they go to traditional circumcision school, some schools are teaching them wrong information of how to belittle women and how to abuse them. So we're trying to say, no, you can't do that. When you go to the school to be a man, you are there to protect women. You are there to ensure that a family unit is constructed and society grows out of you and your contribution as a young man.
Let me see, how are you ensuring that all schools, all initiation schools, or certainly those that are practicing the process are registered and are legal? And also that information, which currently is misinformation in terms of how they are teaching young men to belittle women, as you've illustrated. How do you ensure that that information, or the information that you are speaking about now, is adhered to or administered to these young boys?
Yes, this year we are ensuring that all schools are registered through the headmen and the traditional leaders, the chiefs of the areas. We've established circumcision committees. Those working committees are there to monitor that the tradition is exercised properly in that specific area under a traditional leader. Thirdly, we've got monitoring teams which are constituted by traditional leaders, our counselors, our district health management officers in all districts, and all of us then are this cohort that visits all traditional circumcision schools. When we get there, we want to know who's the principal. We want to see the papers of each initiate that is properly screened and registered. We want to know who is the traditional surgeon who must be there when we are visiting. We want to know who is an assistant, and all these things together, they constitute our readiness for this year. So traditional leaders, we've tried to allocate budget because there were complaints that they can't visit effectively all the traditional schools in their areas because our wards are big, we're a rural province. So we've tried to allocate resources. And let me thank my colleague, MEC Kappa from the Department of Health. She has allocated 40 vehicles that are going to be adding to the vehicles I have. We have 50 vehicles. Municipalities have got also vehicles. So this tradition, we are following it through the district development model so that all stakeholders participate in this, and we try. We are in Ipulo in the Eastern Cape to try and save our kids from going to traditional circumcision school and dying out there. So I'm saying all these efforts. And the last issue is that the police, the general, the acting police commissioner of the Eastern Cape has promised that all police stations in the Eastern Cape will be allocated officers that will be focusing specifically on traditional circumcision. We are fighting for zero death, and zero death is what we must achieve.
CoGTA Eastern Cape MEC Zolile Williams, appreciate your time.